What brought you into the cancer field?
So I was actually a psychotherapist before I started the cancer journey. And at the age of 30, I was diagnosed with cancer, and that really threw me off guard. Um, the moment that I realized that I'm going to be doing this for sure is during my second chemotherapy session. I was sitting in the chemo chair at Cedar Sinai, and there was a very nice, very friendly psychotherapist that came up to me and introduced herself as a therapist and wanted to initiate therapy right then and there. And at the time, I had steroids coming in, getting pumped into me. I don't know what's going on. I'm terrified. I have a 1 year old at home, and I very, very foolishly, I asked her, "Have you ever had cancer?" And she said, "No." And so I thought to myself, and like I said, this is very foolish. There's a lot of psychotherapists out there that are highly qualified to do this work. I just thought, nope, not happening. Like I need to talk to somebody who understands what's going on. And as that chemotherapy session was progressing, there were all these volunteers that were coming, and they had a basket in their hand with fruits and snacks and beverages, and they introduced themselves as volunteers who were also cancer survivors. And and then all of a sudden I had all these questions for them. How long did it take for your hair to grow back? How long were you sick? Did you have a child at the time? How am I going to go home to my 1 year old and parent? And I knew right then and there that, hey, first of all, cancer patients want to speak to other cancer patients. And that was my quest to start looking for a therapist that was also a cancer survivor, and I really struggled to find one. And so I actually didn't find one. I settled for somebody who wasn't. She's still my therapist. She's excellent. But that's how I knew that I was going to get out of this situation first, give myself some time to heal, and then eventually start working with cancer patients.
It sounds like you really saw that need, and it was something that you wanted to have that connection and understanding from a therapeutic standpoint to then really have that um, be a way to feel like you could then heal and be understood.
Yeah. Oh, absolutely.
Well, I understand that you recently presented on mental health and cancer at the Cholangiocarcinoma Foundation Conference. Can you walk us through some of those talking points from that presentation?
It was an hour-long presentation, so I'll try my best. It started off at, like, all most psychotherapy sessions that I have usually start off with very common themes. People come in and they are confused. The population that I work with usually come in and report the same things. I don't understand how this can happen to me. I'm young. I'm healthy. I did all the right things. Why me? I don't smoke. I don't drink. I have been on the organic bandwagon for 10, 20 years. And how could something like this happen to me? And so I addressed that in the conference. That's how I started off, because most people come in and they're really shocked and confused and want question or have all these questions and don't have answers. And unfortunately, medicine, we're not there yet. So we don't, for some cancers, we have some idea, not for every cancer, definitely not specific to the individual. Sometimes it just doesn't make sense. So there's usually fear over the new diagnosis. There's fear over the treatment plan and the side effects. I think oftentimes we come into this journey and we hear cancer, psychotherapy, and automatically we think we're going to die. And a lot of it has been dictated by the media. I've never really watched a movie where there's a cancer patient that survives and has a happily ever after. And so that's the first and foremost is that we address these things. There's usually a whole lot of anxiety that comes into the picture, and so that's something that's heavily discussed. That was actually, I'm going to pause right here because anxiety is something that I spent a great deal talking about at the conference, and just understanding anxiety, I think, through a healthier, more humanistic perspective. A lot of us come in with a lot of anxiety and we might report it to the doctor. And I love doctors and everything, so don't get me wrong. And there's a time and place for medications and everything. But we come into this diagnosis and we're reporting things like depression and anxiety and the inability to fall asleep. And we leave usually with a handful of medications and prescriptions. And I spent a great deal normalizing anxiety and truly dissecting it and offering a healthier perspective on it, and that our brains are wired for survival. We want to survive. And so when we hear of a life threatening disease, we automatically go into the state of anxiety. And it's there to protect us, honestly. It's that anxiety sometimes that drives us to go into the next chemotherapy session knowing that we're going to leave really in bad shape. It's the anxiety that pushes us to go into that next PET scan or CT scan, and do the things that we need to do to get on the other side. And so, developing a healthy understanding of what anxiety is will then allow us to manage it a little bit better without the overuse of medications that we often see now. Um, and so that there was a great deal of time understanding that and the root of that. There's always fear of relapse and reoccurrence. I think, and I'll share this story from my own experience. I remember the first time I went into a support group for lymphoma, and I was at the halfway mark, and I had my midway PET scan, and the doctor came in and he said, there's a significant, improvement over 50%. We can't really tell you. I don't know. I had a 14 by 10 size, mediastinal mass in my chest cavity. And so he said, there's just significant improvement. We're on the right treatment plan. This is what this lets us know. And I was so happy. I was elated. Like, okay, whatever this was and however bad this chemotherapy is, it is medicine. I really learned then that, you might walk in thinking, oh, this is toxic and this is poison. But I learned then that chemotherapy is medicine. It is a real medicine, and it puts people in remission and it saves lives. And so I started to develop a healthier mindset around chemotherapy. But I'll never forget when I walked into the support group and I sat there with my amazing news, and the girl right next to me had the same exact cancer, same exact age, I mean, same profile, but she had relapsed. And prior to it, I knew nothing about cancer. I knew nothing about the possibility of relapse. And I freaked out. I totally freaked out. I was like, wait a minute, I could be doing all of this just to relapse. And it was something that I'll never forget, just really struck me. And so the fear of relapse is always going to be there with any cancer diagnosis. And these are things that come up in every single psychotherapy session. Um, I also spent a great deal talking about maladaptive coping skills that can happen with this diagnosis and post this diagnosis. And that can look like a host of things. Eating disorders, which I'm glad Dustin is on here, is something that I often see. And I see it in a lot of women who maybe have a history of it, of an eating disorder, even if they, had the eating disorder in their adolescence and now they're in their 40s and 50s. And it usually starts from this need to control. And so they usually come in with a super healthy lifestyle and healthy whatever, but something glitched and something went wrong that caused cancer. And the first thing that they tend to do is latch on to their eating. That's the one thing I can easily control. I can cut out all these things from my diet, and then maybe I can control the outcome of whether I'm going to relapse or not. It starts off really cute. It's very subtle. I stopped eating all these highly processed foods. Excellent. That's what yours, that's awesome. But then, it turns out this causes cancer and that causes cancer. And did you know this causes cancer? And then we're like in full blown now monitoring every single thing that comes in and out of our mouth. We're not doing well. It's affecting our mood. It's affecting our sleep. And then we're back into like the loop of an eating disorder. Substance abuse is obviously another thing that can come up post cancer as people are trying to adjust and adapt to their pre-cancer lives.
What do the stages of grief and adjustment look like for people with a new cancer diagnosis?
So just like everything that we know about the stages of grief, which are, very straightforward: denial, anger, bargaining, depression, and acceptance. So typically people will come in and there's this sense of denial. Maybe the doctors got this wrong. Maybe if they rescanned, maybe it wasn't my scan. Maybe they messed up. People mess up all the time. And so these things are natural thoughts that happen. And then once we come to realize that this is a real thing, this is my diagnosis, my reality, oftentimes we experience anger. I know for me, I was a really angry person when I realized, when I woke up and realized, oh my God, this is a nightmare. It's like I just woke up from this nightmare. Bargaining. I will do whatever it takes to get out of this. So I hear this all the time. I swear I'm going to church every single Sunday. If I God gets me out of this thing, I'm, and there's this bargaining that's happening. I will never eat a chocolate bar again. I I will do all these things. I'm going to bargain my way out of this. And then when you realize that life doesn't work like that, then we're hit with the depression, and then obviously hopefully we get to a point of acceptance that this is my new reality, that I have to start creating a new life with cancer in it, that there is really no coming out of it. Even in the state of remission, you're always in it. I mean, I see my oncologist every 6 months. I am sure, every single person that has had this diagnosis realizes that they're never actually out of it. And oftentimes we are led to believe that once you're done with treatment, you are done. You're good to go. And then you realize, oh no, the doctor wants you back in 3 months for a follow up, and you're like, why? I'm done. And no, it doesn't work like that. And also, I want to make this a point. This is not linear, so we don't just go through these stages of grief and then we're done with them. We're just like cycling through them, and it comes in waves, just like any cycle of grief, actually, in any context.
Yeah, I think that acceptance piece is really challenging because there's just that thought in the back of your mind, like, what if this didn't happen? Or like,
Yeah.
and all that like resistance to like what has happened.
Oh, absolutely.
I like to think of acceptance as like something that's just chipped away at too. So it's not like I'm going to be 100% acceptant of everything that's happened, but maybe it's just being able to then sit with it for that minute and recognize that this is my reality, rather than trying to push away and say like I can't feel this, or I can't experience this, or this thought is too painful, or whatever that might be. That's that pushback from that acceptance. So
Yeah.
um, understand that you spoke on some uh, differentiation between like a internal and external coping skills. Wanted to just have you speak to that.
Yeah, so during intake, this is always like a challenging exercise for a lot of people. I'll usually ask something along the lines of, "What are your coping skills? What do you do? What do you do to get out of these scenarios historically?" And then I'm hit with like a list of all of these what I call external coping skills. I exercise. I like reading. I knit. I do all these like things that are physical, and it's all wonderful because that's what we were taught. That's like the easy way out of every, like, actually it's a healthy way out, but it's like the easy thing to do. Go for a walk. We know that that's like going to be successful. And then I always ask, well, what if I took all of those things away from you? The ability to exercise. If you were a runner, what if I took away the ability to go for a run, which happens all the time in my practice, like all the time. People come in with this, like, oh, I love that adrenaline that I get from running. Well, what if you couldn't do it anymore? What if you were in the hospital?
Yeah,
Uh,
just yoinked from that
what if
from
you
that.
lost legs as a result of this? Which I unfortunately see that too. What if you couldn't knit anymore because of neuropathy? What if, and then they're like, well, what do you mean? And I'm like, those are your internal coping skills that I'm trying to pull from. And most people will respond, well, I don't know if I have that. I don't know what is that? What is an example of that? And to me, an internal coping skill well, first of all, requires a lot more internal work to understand and identify. But if I had to break it down to like one very simple concept, it's the ability to positively self talk. It's like this really healthy mindset of, and it requires you to let go. There is a loss of control in that. I have no idea what's going to come next, but I know that I'm going to have the tools to get out of it. I know that there's going to be an end to it. And it's this, just this ability to tell yourself that. And that starts from, I think, from early on in childhood, and is something that a lot of people really struggle with, whether their core beliefs are that they're not worthy of it, or that they're not good enough, or that they can't get themselves out of situations. And that's something that I spend a great deal working on with people, because that is a terrifying thing. What if I couldn't do all the things that I've always been taught to do to self soothe and to regulate and to cope?